Just because a patient doesn't have health insurance doesn't mean they're not going to be sick. I mean, some of these patients make under $8 an hour. I mean, how can they afford a $150 visit? The mission of this clinic is that we want to reach out to the population that is most marginalized. Anyone who does not qualify for health insurance, who is unemployed.
Pretty much without the clinic, I don't know what I would have done because I couldn't afford to go to any other clinic. It just started the journey of getting healing instead of more stress causing the lump to keep coming back. And you don't have to worry about finances.
I myself am a cancer survivor, and that makes it all the more important that I catch every woman out there that's sitting on breast cancer. Where in this country is anybody able to deliver that kind of care? And the reason it's happening is because we have people who believe in our mission.
Pain was over, I was done with it, and the lump was gone after surgery, and everything went well. Thanks to the clinic, everything went well.
Good afternoon, ladies, friends, IWF, our president, and everyone that's here tonight. This is an exciting day. It may be a rainy day in Georgia, but it really is not one in here. It's raining with wonderful, talented women. You've just seen something that is very near and dear to my heart. I have known Gulshan. Gulshan, stand up. I know you're going to be up here in a few minutes, but I want you to see this wonderful woman that I have known for many years. I won't say quite how many, because she and my daughter practiced medicine at one of the first Doc in the Boxes at Toco Hills many years ago. She is a true visionary, and as you saw with the video, she has worked on this project for 5 years. It has served many, many people, and it is located in Clarkston, Georgia, which is one of the most diverse communities in the entire United States. She has brought health care to a new level through volunteerism, and we are so proud that you are one of us, an IWF member. I'm so, so proud of you. And it's particularly significant today as we celebrate International Women's Day. And I can't think of a better program, and all of them have been wonderful. But the old saying that our health is our wealth. And what she has done has opened up an avenue so that we have a healthier community through volunteerism. And yes, she has this free clinic, and I would urge any of you to give me a call, because just to go out there on a Sunday and see what's going on. She told me of an incident. Can I repeat it? Because I'm not going to tell you who the person is. She told me that someone came into the office on Sunday with an A1C of 15. Now, my daughter's an endocrinologist. That is out of sight. 500 sugars. I want to get it straight because I'm not a doctor. What she was able to do through volunteerism to provide insulin, education, and I know saved this individual's life. So it's not just general health, but it's saving people's lives. And we are so fortunate here in this room to know what good medicine is, to have good doctors, but what Gulshan has done, and now she has come up with this wonderful idea, and she has raised half of the money. This 8,000 square foot building that is going to be built, and I'm not saying if it's going to be built, it's going to be built because of some of us that are here today that understand how important this is. She has formed a 501(c), so it's all tax deductible. And this facility will not only be for medical things, but it will also have dental care. She already has plans for 3 dental chairs. Did I get that right? Okay, I'm just checking with the doctor. And today, what I'm supposed to do, which is a real privilege, is to say that this visionary individual that gave up her own practice last year so that she could do this full time is here today. So I'm asking all of us today to consider not only donating, but going to our friends and our organizations and our businesses that we know and our foundations. The entire cost of this building is going to be $1.6 million. She has already raised half of this. I know we can do this. When we had that wonderful meeting in Clarkston, the thing I said to her, and everybody knows I always blurt things out, and I said, Dr. Harjee, what do you need? And she said, well, we'll get together with a group of women. And that's exactly what she did. She got together with a group of women that understand what this is all about. So today, I want to say thank you for all you have done. But I wanted this to be a caveat for our group. IWF is not raising money. We are doing this as individuals from our good heart because this is what we're all about. And as one of the founders in 1988, we only had a small group. As a matter of fact, I refreshed my memory of that's how we started. That was our membership, our first stationery. But we were down in Callaway Gardens with Mrs. Carter. And for all of you that know this, that Mrs. Carter was a real mental health person. And she said, women, I found a shoe factory on Edgewood Avenue. And I'm able now to furnish this and have this for mentally ill, homeless people. There were only a handful of us, but we took this on as a project. We furnished 40 rooms. Now, when I tell you 40 rooms, they were tiny rooms with single beds, and all they had on them was a nightstand. But we took that on as a project, and it was successful, and Mrs. Carter still talks about that project because it helped the mentally ill homeless, 40 individuals that were there in the evening. Hundreds of people come through this clinic. And I'm asking you today to think about this because we as women know what has to be done. And I'm confident, Gulshan, that IWF Georgia is going to get it done for you. Thank you.
Thank you, Liane. So, as all of you know, force of nature, this one, Liane, and I want to thank her for starting this whole process for us for this call to action. It indeed started with the conference we had in Clarkston a little over a year ago, I think, with Liana's question, what do you need? What needs to get done? And this is a room full of women who do and get things done. So we began to coalesce around that thought. And as the day, the International Women's Day program began to come together, the idea of a call to action rose as part of that, because it is our chance to ask for that and put something very tangible in front of this group. So that is what we're doing. So I want to hit on a couple things. First, I'd be remiss if I didn't thank Salima Abdul Ghaffur, who was my partner in putting all of this together for this portion of the program. In the true spirit of International Women's Day, she was called away to Kenya for work, so she is en route there now. But she is here with us in spirit and has helped put this together. Couple logistics and things to know about this overall campaign. It is a $1.6 million, as Liane said, $1.6 million capital campaign to move the Clarkston Community Health Center out of a very cramped quarters that they are in now, in a building that I've been there on multiple occasions. It is not unusual to see folks lined up out the door. They do amazing work, but they are truly bursting at the seams. This is the rendering of the building they'd like to go to. It would be built actually for the purposes of medicine and healthcare, and could do the kinds of work that they do so well in a much bigger space. It is also in Clarkston. As Liane mentioned, they've raised about half of that money already, and we're hoping that as part of this program today, we can push them even farther down that line. The number that you see here, so they've made it easy for you. We all have cell phones. The Clarkston Community Health Center has a text to donate app. We're asking you to think about doing that if you would. It's as simple as texting support CCHC, support Clarkston Community Health Center, and text that to 44321. If you've got this card that was handed to you either as you walked in the door or from there, that number is repeated on this card, as well as other ways to contact the center and more background information on the center. So if your passion is to volunteer, if your passion is time, talent, treasure, any one of those, the way to get in touch is on this sheet for you. Or go here, support CCHC at 44321. It's simple, it's easy, and you'll immediately get a receipt back from that for tax purposes. A couple other quick things. Gulshan will be up here in just a second to tell you a little bit more, but there's a table out in the lobby as well, so at the break you can get a little bit more information on this effort there. And I'm also really, really pleased to announce that IWF Georgia as an organization has plans to make a contribution to this organization as a match to the dollars raised here today. So thank you for that to our group. I'm excited for that. Thank you. Thank you. Okay, those are the logistics, but much more important is the work that's actually being done at the center and the people behind it. So I'm pleased to welcome another force of nature, Dr. Gulshan Harjee, and just a little bit about Gulshan. If you have not met her, please try to introduce yourself to her today. I will tell you that the warmth and the caring and the deep intelligence that this woman exudes will hit you from the moment you meet her. You will also see it on display when you go to the center. The crew of volunteers, doctors, nurses, physician's assistants, and a host of really bright young medical students and nursing students that are incredibly loyal, all volunteer efforts working for this woman, and Saeed Rais, her other co-founder, are extraordinary. And the energy that it comes from here, a quiet but bold energy from Dr. Harjee. In the name, and truly, of International Women's Day, it's hard to find anybody who isn't kind of the epitome of thinking globally and acting locally. As Liane mentioned, Dr. Harjee left her practice of nearly 30 years, sold it recently to dedicate herself full-time to this clinic that they opened in 2015. The goal is to treat the underserved and the uninsured, particularly the very vulnerable refugee and immigrant population in Clarkston. Dr. Harjee herself, born in Tanzania, is an Emory-educated doctor, speaks 7 languages. She is a breast cancer survivor and is absolutely passionate about women's health care because of that. She is the proud mother of a daughter who is also now in med school, who will carry this forward. Please, if you haven't met her, I do encourage you to meet her, but I'm going to bring her up now to tell you even more from her about the center.
Thank you so much, Liane, Amy, Salima. I can't thank you enough for this endorsement coming from Liane, my mentor, who I knew, I'm going to say, 35 years ago. And Liane, I know that you're kicking yourself and saying, I wish we had this clinic when you were CEO of DeKalb County. Unfortunately, I was young at the time, selfish, and was not ready. But like everything else in life, there is always the right time for things to happen. But this, I'm sorry. For me to be standing here, a young girl from a village in Tanzania, to be in this room of such powerful women is a dream. And to be able to serve the underserved is an even bigger dream. So as they say, I'm living a real dream. This is every day that I go to that clinic is just so exciting for me, because this to me is just giving back to society. I came here exactly 40 years ago, landed at Atlanta Airport with only 6 months to my passport expiring. And if it was not for Dr. Louis Sullivan, who listened to my story and admitted me to Morehouse School of Medicine, and then Dr. Nanette Wenger, who is already a member of this IWF, who interviewed me and admitted me to Emory, where I graduated, I've come a full circle. I cannot thank this country enough for the wonderful opportunity of a great education. All I'm doing is just giving back to society, and I thank you all for that opportunity. Thank you. Thank you. Thank you very much. Thank you so much. 5 days a week, every week, rain, sunshine, snow, our 400 plus dedicated volunteers show up at Clarkston Community Health Center to serve. And I'm going to put on my brag hat right now for the sake of these volunteers. Clarkston Community Health Center is the most comprehensive, ethnically, linguistically, and culturally most sensitive, providing comprehensive care to the underserved in the state of Georgia. And I believe that this model does not exist anywhere in the country because we have 8 academic collaborations that allow us to deliver this care. Students, faculty that come to serve are able to experience global healthcare as well as deliver healthcare in the fashion of volunteerism. They get to learn about healthcare right at the bedside, and that is why we are able to deliver comprehensive healthcare to 4,500 individuals for under $165,000 for last year. This, however, is not sustainable because our 2,200 square foot humbling facility can no longer accommodate the kind of care and the numbers of individuals that we continue to wish to deliver care to. So we have now launched a capital campaign of which, as you know, we have already received half the amount, and we are so excited. As a matter of fact, we were at a hearing last night at the DeKalb County, and there was no debate. Every commissioner was excited, and so we are now going to lodge our permit, and hopefully Liane and all your friends will hoot for us and push that permit so that we can start digging. But so who are these 4,500 patients that we treat? Just an example, this past Sunday, this Rwandan widow walks in with 3 children, and she has finally decided that after 3 months of wanting to drink a gallon of water every day was enough. She said, I can't stop going to the bathroom, and I'm just drinking water, and I decided something's wrong with me. Well, the volunteer nurses immediately triaged her blood sugar of 500. So we pull her to our point of care lab. We are the first free clinic in the state of Georgia to have this point of care lab gifted to us. What this point of care lab is that you have your blood drawn, and right while you're in the clinic, your reports are delivered to you. An A1C of 15, as Liane says. So this lady has been walking around, taking care of her 3 children, working for $8 an hour. How and where in this state would she be able to get care? We immediately started hydrating her, and I was in her language, Swahili, able to explain to her what her condition was, showed her how to deliver insulin, how to give herself a sliding scale, how to eat different, mark her logs, and she went home with 5 vials of insulin. You know what insulin costs. $1,000 a month. If you're on high-dose insulin, it's $1,000 a month. If that patient had gone to an urgent care, she would be billed a couple thousand for all that care that she got. If she went to an emergency room, that would be twice as much. So this is just an example, just one example of the numbers of patients and the severity of the disease that we're able to treat. So I thank you all for this great opportunity. Now that I think we've passed our probation of being successful for 5 years, we'd like to move into a larger facility. I invite you all to come tour the clinic while we're in action. And I'd love to show you the volunteers, and I'd love to show you what we do, because I think seeing is believing. So with that, I'd like to close here and say that I would like to see you there and hope that you'll be able to help us get to our new facility.